Hello, Medicos. Good day to all of you. And this is Dr. BK for you. So today in this class, we are actually continuing with the brainstem. So in the brainstem, first we have discussed about the medulla oblongata. Now, actually, we are going to continue with the pons and the midbrain. Now, our learning objectives for today is mainly on the pons. So under the pons, we will be discussing about the situation, external features and internal features, blood supply and clinical aspects. Then followed by the pons. So under the midbrain also we will be discussing about its situation, external, internal features, blood supply, and followed by that the clinical aspects. Now, first of all, when you look at the pons, mainly here you are able to see that it is also called as the bridge. So it bridges between the two cerebellar hemispheres. So that is one reason it can be called as the bridge. The other one is it is bridging between the midbrain above and the medulla below. So then that is why it is also called as the bridge. So both ways it can be taken. So it is actually present in the infratentorial compartment. So below the tentorium cerebelli on the posterior cranial fossa. Okay, so it is related to the infratentorial compartment and also in the posterior cranial fossa. Okay, so you can see that immediately on front of it lies the posterior sloping surface which is called as the clivus. Okay, so this posterior surface which is called as the clivus, you are able to see that, which is mainly formed by the basilar part of the occipital bone and the sphenoid bone. So between the bone and then the pons, you also have a collection of CSF which is actually called as the pontine cistern. Okay, now that is the relation of the uh, anterior surface. So it is related to the clivus part of the bone, and then you also have the pontine cistern, or called even as the cisterna pontis. Okay, you know the cisterna pontis communicates posteriorly with the cisterna magna and above with the interpeduncular cistern. Okay, so that is the anterior surface of the pons, and which is marked by numerous transverse fibers. And laterally you can see that is the massive middle cerebellar peduncle. Okay, the largest of all the cerebellar peduncles. So mainly it has got a dorsal surface and a ventral surface which you are seeing here, and it's got a superior border and an inferior border. So these dotted lines marks the superior and inferior limit of the pons. So now coming to the external features, mainly, so the ventral surface, you see a shallow groove, and that is actually called as the basilar groove. So the basilar artery is actually lodged in this. That is the two vertebral arteries, they unite to form a single basilar artery. So the basilar artery is lodged in this groove, and on either side you are able to see these lines are also called as the transverse fibers of the pons. So it is grooved by the transverse fibers. Then you are able to see the emergence of the trigeminal nerve. Okay, so the both nerve rootlets, what you are able to see is the trigeminal nerve. So that is the sensory part and then the motor part. Okay, so the fifth cranial nerve emerges from the ventral aspect or a bit laterally. Now, lateral to this is actually the middle cerebellar peduncle. So the emergence of the trigeminal nerve marks the demarcation between the pons and the middle cerebellar peduncles, because the transverse fibers, they are continuous. So that is the only identification point. So medial to that, it is a part of the pons, and lateral to that, it forms the middle cerebellar peduncle. Okay. So next, coming to the other external features, the lower border of the pons, you have the pontomedullary junction. So on the pontomedullary junction, you can see more medially on either side of the midline, that is the abducent nerve. So to be more precise, we can tell that this nerve emerges between the pons and the pyramids, what you are able to see there. And more laterally, between the pons and the olives, you can see the seventh facial nerve, and then the eighth cranial nerve. So that is the rootlets of the seventh cranial nerve, and more laterally the eighth cranial nerve, or the vestibulocochlear nerve, which you are able to see here. Okay, then here posteriorly there is an angle between the pons and the cerebellum, that is called as the pontocerebellar angle. Okay, so that circled area is actually called as the pontocerebellar angle or cerebellopontine angle, which is between the pons, cerebellum, and then the medulla. So that is lateral to the opening of the fourth ventricle. Okay, the roof of the fourth ventricle will be present here, and lateral to that opening of the fourth ventricle, you can see this cerebellopontine angle. So the contents is mainly, you see the seventh nerve. Okay, and then you will be able to see the eighth nerve. So seventh nerve, eighth nerve, and then also the glossopharyngeal nerve. So the glossopharyngeal nerve, and then the facial and the vestibulocochlear nerve, and nervus intermedius, which is nothing but the sensory part of the facial nerve, is called as the nervus intermedius, and sometimes even the labyrinthine artery. So the labyrinthine artery also, what happens is, lies in this content, which is going to enter the middle ear to the internal acoustic meatus. So that is about the cerebellopontine angle. And superior border is actually related to your above cerebral peduncles, and winding is the superior cerebellar artery. So here you are able to see that is the superior cerebellar artery, and inferior border will be related to the upper part of the medulla oblongata. Inferior border will be related to the medulla oblongata and inferior cerebellar arteries. Okay, superior and inferior cerebellar arteries, which mainly supply your the cerebellum, upper surface of the cerebellum and lower surface of the cerebellum. Now, posterior aspect of the pons. When you look at the posterior aspect of the pons, it is again triangular in shape and forms the upper part of the floor of the fourth ventricle. So lower part of the floor of the fourth ventricle is formed by the medulla. So in that we have seen about the vagal triangle and the hypoglossal triangle, and more laterally the vestibular triangle. The same way, certain features you can actually appreciate in the posterior part of the pons, which forms the upper part of the uh, fourth ventricle, which is also called as the rhomboid fossa, because it is rhomboid in shape. So mainly in the midline, what you are able to see is the median sulcus, and on either side of the median sulcus, what you see is the sulcus limitans. Okay, so you see the median sulcus in the midline, and on either side what you see is the sulcus limitans. So between the median sulcus and the sulcus limitans, this raised area is actually called as the median eminence. It is actually called as the median eminence. And lateral to the median eminence, what we saw is the sulcus limitans, and then more laterally, like you see the vestibular area. So this is the vestibular area, which is shared both by your pons and then the medulla. Okay, which is shared by the pons and the medulla. Then you look at the sulcus limitans, and inferiorly it shows a bulge which is actually called as the facial colliculus. So colliculus means actually swelling. It is the facial colliculus. So the facial colliculus is actually produced by the nerve fibers of the facial nerve winding around the abducent nerve. Okay, so the winding of the facial nerve around the abducent nerve forms a bulge on the floor of the fourth ventricle, which is called as the facial colliculus. Okay, and then upper part you are able to see on either side of the sulcus limitans. There is an area which is called as the substantia ferruginea, or the other name for it is the locus ceruleus. Okay, so the locus ceruleus, deep to it what you have is the nucleus ceruleus. So the nucleus ceruleus mainly consists of the noradrenergic neurons. So it is one of the area where there is a large concentration of the noradrenergic neurons. So now coming to the internal feature. So far we have discussed about the external features. So ventrally you have the basilar groove and then the transverse fibers, more laterally continuing as the middle cerebellar peduncles. Then we saw the emergence of the trigeminal nerve. Then posteriorly what we have seen is the mainly the features of the floor of the fourth ventricle. Then inferior border, it is actually the pontomedullary junction, emergence of sixth, seventh and the eighth cranial nerve. Followed by that we also saw the cerebellopontine angle. Now coming to the internal features, first the anterior part of the pons is actually called as the basilar part, and before that the internal features is described at two levels. So one is the lower level at the level of the facial colliculus. Okay, so first at the lower level what you are able to see is the level of the facial colliculus. So how do you identify this? You can see the winding of the facial nerve, fibers from the facial nerve, and that is forming a swelling which is called as the facial colliculus on the floor of the fourth ventricle. So this is what we have seen in the previous slide. So first let us try to understand what are the features on the ventral part or the basilar part of the pons. So this is actually called as the basilar part of the pons. So it is marked with numerous nuclei which is actually called as the pontine nuclei. So these are actually group of neurons which receives fibers from the cerebral cortex. So the fibers relaying in this is actually called as the corticopontine fibers. Okay, so they are actually called as the corticopontine fibers. So the pontine nuclei receives fibers from the cortex, from all the lobes of the cerebral cortex. You have frontopontine, paretopontine, temporopontine and occipitopontine. Okay, so from these the fibers they come and relay into this nucleus, and these fibers after they relay, the axons from these nuclei start as transverse fibers. So these transverse fibers cross to the opposite side and they constitute your middle cerebellar peduncles. Okay, so they constitute the middle cerebellar peduncles. So in between the pontine nuclei and transverse fibers, you are able to see these are all the cortico descending fibers, the bundle, discrete bundle of fibers which you are able to see here. Okay, so these discrete bundle of fibers are actually called as the descending fibers, which is going to the medulla and the spinal cord, and that is your corticospinal fibers. So apart from the corticospinal fibers, these also have corticobulbar fibers. So whenever it is bulbar means you should actually recollect it is the corticonuclear fibers. So mainly they are distributing to the cranial nerve nuclei which is present at the lower levels. Okay, so the medulla, there are other cranial nerve nuclei. So the corticobulbar fibers and corticonuclear fibers are present as discrete bundles because these bundles are broken up into collection or bundles of fibers because of the transversely running fibers of the ponds which emerge from the opposite pontine nuclei. They are called as the transverse fibers of the ponds. Okay, so these transverse fibers mainly form the fibers of the middle cerebellar peduncle, and they are in the cortico-pontocerebellar pathway. So that is from the cortex to the pons, corticopontine fibers. Fibers emerging from the forms go to the cerebellum as the pontocerebellar fibers. So this is the main input to the cerebellum via the cerebrum. From the cerebrum to the cerebellum, the main input is actually through the pontocerebellar fibers or cortico-pontocerebellar pathway. So, but most of the fibers they cross to the opposite side. Some fibers also pass ipsilaterally on the same side to the same cerebellar, middle cerebellar peduncle. Okay, so that is the pontine nuclei, and then you are able to see the corticospinal and the corticonuclear fibers. These are present as collection of bundles which are descending downwards. The other motor are descending fibers. Okay, so that is mainly about the basilar part of the pons. Now, coming to the behind that, this part is actually called as the tegmentum of the pons. Okay, so what do you come across mainly the features in the tegmentum of the pons? You see the medial lemniscus. Okay, so that is actually the medial lemniscus. And then you have the trigeminal and the lateral lemniscus. Okay, so you see the medial lemniscus and then the trigeminal and the lateral lemniscus. So you know what is the medial lemniscus? This is the crossed internal arcuate fibers, so which is carrying your discriminative touch and proprioceptive information. Then trigeminal lemniscus, mainly the fibers of the spinal nucleus and tract of the trigeminal nerve. And then what you see is the spinal lemniscus, so which consists mainly of your lateral spinothalamic tract. So this is seen on either side, the lemniscal pattern, and they are more transversely oriented. Okay, they are more transversely oriented. So spinothalamic tract is nothing but your spinal lemniscus, mainly the lateral spinal lemniscus, lateral spinothalamic tract. So along with that you also see the mainly your spino-reticular, and that is your medial lemniscus, which you are able to see here. Okay, so then you are able to see even the spinotectal tract. Okay, so that will also be closely associated with this lemniscal pattern. Okay, which is again an ascending tract. Then in front of the lemniscus, you come across this structure which is called as the trapezoid body. So mainly the trapezoid body is nothing but the fibers of the cochlear nuclei. Okay, so the fibers of the cochlear nuclei is called as the trapezoid body. The crossed fibers of the cochlear nuclei is actually called as the trapezoid body, and they continue as the lateral lemniscus. Okay, so trapezoid body continues above as the lateral lemniscus. So these are the fibers of cochlear nuclei which will be actually situated or related intimately to the inferior cerebellar peduncles. So anterior and posterior cochlear nuclei will be seen uh, anterior and posterior to the inferior cerebellar peduncles. Okay, then posterior part of the tegmentum forms the floor of the fourth ventricle. So that is you are able to see the floor. So deep to this only you are able to see these cranial nerve nuclei, which we will be discussing. So medially what you see is the abducent nuclei, and more laterally what you are able to see is the vestibular nuclei. Okay, so that is the vestibular nucleus, medial and lateral vestibular nucleus, and then more medially you are able to see the abducent nucleus. So they are from medial to lateral along the floor of the fourth ventricle. Along the floor of the fourth ventricle you are able to see that. And beyond that, this is part of your cerebellum. These are the deep cerebellar nuclei. Please don't just confuse it now. This we will be discussing only in the cerebellum. So abducent nuclei, and then what you see is the mainly your vestibular nucleus. Then anterior and slightly lateral to the abducent nucleus, what you see is the facial nucleus. So you're able to see, so that is the facial nucleus, somewhat ventral and lateral to the abducent nucleus. Ventral and lateral to the vestibular nucleus, you are able to see the spinal nucleus and tract of the trigeminal nerve. So this is the spinal nucleus and tract of trigeminal nerve, or it is situated in front of the cerebellar peduncle, middle cerebellar peduncle, which you are able to see here. Okay. Now coming to the facial nucleus, the fibers of the facial nucleus first passes dorsally and then medially. Okay, so the fibers of the facial nucleus first runs backwards or dorsally and then medially, winds around the abducent nerve nucleus. You are able to see winds around the abducent nerve nucleus. So first it is seen between the abducent and the vestibular nucleus. Then you are able to see it is seen between its facial nerve nucleus and the spinal nucleus of trigeminal nerve. Okay, and then finally it emerges out at the pontomedullary junction. Okay, now why actually this winding around takes place? First, this winding around of the fibers forms a bulge or impression which is called as the facial colliculus, which is called as the facial colliculus. Okay, second thing, why this takes place is might be the nucleus would have migrated from the original position, which was somewhere lateral and slightly medial. So even though it has migrated, what happens is it is taking its original course of route, and this is a very good example of neurobiotaxis. So which means based on the some stimulus, the movement of the fibers is in its original pathway. So that is actually called as the neurobiotaxis, some stimulus through which what happens, it is following its original pathway. So that is about the facial nucleus and the facial colliculus. So this looping is actually called as the internal genu. You know, one more external genu which you see in the facial canal. So which is passing the facial canal, which are able to, which we have seen in the medial and the posterior wall of the middle ear cavity. So this internal genu, there you have the external genu or bend. Okay. So more laterally you are able to see the inferior cerebellar peduncles, and immediately in front of the inferior cerebellar peduncle is your spinal nucleus and tract of trigeminal nerve. And this inferior cerebellar peduncle, the dorsal and ventral cochlear nucleus will be intimately related to it. So next, coming to the structure of the pons at the level of superior collicles. So inferior colliculus mainly we can identify by the presence of the facial colliculus, facial nerve nucleus, facial colliculus, abducent nerve nucleus, and the vestibular nucleus. Now in the upper part of pons, the other things are always same. So you are able to see the transverse fibers, pontine nuclei. So pontine nuclei, from that the transverse fibers they start and form the massive cerebellar peduncles. These transverse fibers break the descending fibers into discrete bundles. So these are the corticospinal fibers. Okay, and the corticonuclear are also called as the corticobulbar fibers, and behind that you see the trapezoid body and the lemniscus. So medial lemniscus, and then you have the spinal and the trigeminal lemniscus. Okay, and this is your reticular formation, and that is your floor of the fourth ventricle. So the floor of the fourth ventricle, in the midline you also have the mainly your medial longitudinal fasciculus and the tectospinal tract. Okay, so medial longitudinal fasciculus and the tectospinal tract. More laterally you are able to see the superior cerebellar peduncles. So because slowly you are approaching near to the midbrain, you are able to see the superior cerebellar peduncles more dorsally, whereas laterally you see the massive middle cerebellar peduncles. Now the main structure difference between the superior and inferior part of the pons. Upper part of the pons, you see the trigeminal nucleus. So this is the trigeminal nucleus, which consists of two, a large lateral sensory nucleus, which is very large, or principal nucleus of the trigeminal nerve, and small medial nucleus, what you are able to see, that is the motor nucleus. So small motor nucleus, both of them arise separately, they don't actually join. Then the trigeminal nerve also consists mainly the large sensory nerve root and small motor nerve root. The sensory nerve root will actually go and relay in the sensory ganglion. Motor nerve root does not relay in the ganglion. It passes below the ganglion, and then what happens is it joins only with the mandibular division in the foramen ovale. Okay, so then both you can able to see emerging from the pons, and that emergence demarcates your pons from your middle cerebellar peduncle. Okay, then other features, as I told you, along the floor of the fourth ventricle, mainly you see the medial longitudinal fasciculus. Okay, apart from the lemnisci, I have already discussed to you. Medial longitudinal fasciculus, again in the medulla, I told you it connects mainly your third, fourth, sixth, and eighth nerve and the spinotectal tract. So this is with response to movement of your head, neck, and the extraocular muscles. Based on your visual as well as your auditory stimuli. Okay, so mainly for maintenance of these balance, this is the fiber tract which connects third, fourth, sixth, and eighth nerve with this, and also the spinotectal tract. So you see the medial longitudinal fasciculus, then you are able to see the tectospinal tract. So that is the main function of the tectospinal tract, is to move your neck muscles based on your visual stimuli. Okay, and then your rubrospinal tract also. So the rubrospinal tract again is mainly responsible or part of your extra pyramidal system. So mainly for the smooth coordination of the muscle movement and maintenance of the muscle tone. Okay, now finally coming to the blood supply of the pons. So it is mainly supplied by the pontine branches arising from the basilar artery. So the basilar artery gives out pontine branches. They are paramedian in position, and they also wind around, and they also form the circumferential branches. Then apart from that, from the branches from the basilar artery, pontine branches, it is also supplied by the superior cerebellar artery, also supplies the pons. Okay, and then you have the anterior inferior cerebellar artery. Okay, so the anterior inferior cerebellar artery, which gives your mainly your superior cerebellar artery. And then coming to the clinical aspects. So clinical aspects of pons, mainly pontine hemorrhage. So hemorrhage to the arteries within the pons leads to paralysis of facial muscles. So because the facial nerve is damaged. Then hyperpraxia and pinpoint pupils because of the hypothalamus. Fibers from the hypothalamus and descending autonomic fibers are involved. The pupil pinpoint, it does not react to light or accommodate. So pinpoint pupils, hyperpraxia, pyrexia, because of the involvement of the hypothalamus. So reticular formation, autonomic fibers from the hypothalamus leads to hyperpraxia. So it is called as spontaneous hemorrhage, leads to 3 P's, PPP. One is paralysis, pyrexia, and pinpoint pupil. So the actually the patient also goes into a stage of a coma. Okay. Then what is alternating or crossed hemiplegia? Here motor paralysis occurs, but contralateral hemiplegia and ipsilateral paralysis of the facial muscles. So that is called as alternating or crossed hemiplegia. Okay. So contralateral hemiplegia, because corticospinal fibers are involved, so they will cross to the opposite side in the pyramidal decussation. Whereas ipsilateral cranial nerve paralysis, so that is because already this is crossed fibers. So for example, facial nerve will emerge. So lower motor neuron type of paralysis takes place in the mainly in your facial nerve. Then in the other lower parts, your vestibulocochlear, nerve and hypoglossal nerve, mainly tongue and the facial muscles, as I told you. So ipsilateral cranial nerve paralysis and contralateral paralysis of the limbs mainly takes place. Then Meliat-Guebler syndrome is this also is a vascular syndrome only, hemorrhage of the Pons or vascular lesions when the facial nerve is involved. Okay, so naturally you get ipsilateral facial paralysis along with this contralateral hemiplegia. Okay, when the abducens nerve is involved, it is called as the Raymond's syndrome. Raymond's Fovale syndrome, it is called as mainly when the abducens nerve is also involved. Then you also have something called as locked-in syndrome. So when all the motor descending tracts, especially the whole of the basilar part of the pons is affected, then you have quadriplegia because bilateral corticospinal tract, then bilateral facial nerve. So naturally facial weakness. Only vertical gaze and blinking is intact. Only the vertical gaze and blinking is mainly intact, mainly because of your the tectospinal tract is present more posteriorly. So next we are actually passing on to the midbrain. So now coming to the midbrain, the midbrain is actually developed from the mesencephalon. Okay, so it is present between the hindbrain, which forms your pons, medulla, and cerebellum, and above the forebrain. So forebrain mainly consists of your telencephalon and diencephalon. Okay, so this large mass you are able to see is actually a part of the diencephalon, that is the thalamus. So as I told you, it is developed from mesencephalon, and the cavity is a very narrow cavity called as the cerebral aqueduct. Okay, it is called as the cerebral aqueduct, and it actually passes through the free border of the tentorium called as the tentorial notch. Okay, so the cerebral aqueduct connects the third ventricle above and the fourth ventricle below. So we will come to it while discussing about the ventricles. So mainly we are able to see the third cranial nerve which is emerging from the midbrain, and the fourth or the trochlear nerve which is emerging. So the trochlear nerve is the only cranial nerve which emerges from the dorsal aspect of the brain, and especially particularly the midbrain. The other nerves you are able to see, they are almost ventral or ventrolateral. So exactly from the posterior aspect, the third nerve, and it is also one of the very slender among the cranial nerves. Okay, now this midbrain also serves as a visual and auditory relay center. Okay, so the fibers of the retina come and actually relay into the superior colliculus. Same way the auditory fibers relay into the inferior colliculus. So we'll discuss what is superior colliculus and inferior colliculus, and what are their functions in the coming slides. Okay, so almost 2 centimeters in length, and as I told you, it occupies the tentorial notch. So we will move on to the other features of the midbrain mainly. So the relations in front, it is related to the interpeduncular fossa. So you are able to see a gap between the two cerebral peduncles, and that is called as the interpeduncular fossa. And you are able to see the optic tract winding around the midbrain. So that is the optic tract which is arising from the crossed fibers of the optic nerve, that is called as the optic chiasma. The optic chiasma continues laterally as the optic tract. Okay, so interpeduncular fossa in front you are able to see, and laterally the optic tract. When you look posteriorly, so posteriorly you are able to see here, that is the midbrain. So a narrow cavity traversing the midbrain is your cerebral aqueduct. The narrow cavity traversing the midbrain is the cerebral aqueduct. Posteriorly, it is related to the splenium of corpus callosum, and then the pineal gland. And between the pineal gland and the midbrain, that small space is called as the pineal recess. So it is related to the splenium of corpus callosum, and then the pineal gland. So this is the splenium, pineal gland, and pineal recess. and that is the pineal stalk. Okay, so between the pineal stalk and the midbrain is actually the pineal recess. So that is the posterior relations. And in the previous picture we saw that large mass of gray matter. So the posterior expanded part, which is called as the pulvinar of the thalamus, also overhangs. Okay, so the pulvinar of the thalamus overhangs the posterior part of the midbrain. Below, it is related to the upper border of the pons. So the upper border of the pons, which you are able to see here, below it is related to the upper border of the pons. Now coming to the ventral aspect, you see the two large bundle of fibers. They are actually called as the cerebral peduncles or basis pedunculi. So this is cerebral peduncles. But whereas the three other peduncles which we were discussing so far was the cerebellar peduncles. That is the middle cerebellar peduncle which we have seen, and the other two from the medulla is the inferior, and from the posterior aspect of the midbrain is the superior cerebellar peduncles. But this is actually called as the cerebral peduncles, okay, or basis pedunculi. So this mainly consists of the fibers descending from the cerebral cortex. Okay, so then what you are able to see is the lower part of the cerebral peduncles, they converge, but upper part they are actually somewhat diverging. Okay, so they are actually diverging. This is the lower part, they are actually converging and almost near. So they contain all your corticopontine fibers and your corticospinal fibers, corticonuclear fibers. Okay, so most of the descending tracks are descending through this. Of course, they also have the ascending tracks within them. Okay, so the space between these two cerebral peduncles is actually called as the interpeduncular fossa. So which is bounded laterally by the cerebral peduncles, in front by the optic chiasma, and also by the optic tract, and below by the superior border of the pons. So the contents are mainly the mammillary body and the tuber cinerarium. Okay, so it consists of the mammillary body and the tuber cinerarium, which continues as the pituitary stalk. So they all form the floor of the diencephalon. So you are able to see the diencephalon, this part. So mainly the hypothalamus, subthalamus region, subthalamic region, you are able to see that. So the mammillary body and then the tuber cinerarium, and that is your infundibulum or the pituitary stalk. So two structures, and then you are able to see some dotted lines, that is dotted structures, that is called as the posterior perforated substance. Here you are able to see some dots, they are actually the anterior perforated substance, which are two in number on either side. This is posterior perforated substance. So that is the central branches which pierces the neural tissue. So these piercing is mainly forming these small holes, and that is called as the perforated substance. And then the next content is the oculomotor nerve, which is emerging from the interpeduncular fossa. So from the medial aspect of the cerebral peduncles, you are able to see the contents are the mammillary body, then the tuber cinerarium, and then your posterior perforated substance, and then your oculomotor nerve. These are the contents of the interpeduncular fossa. Okay, the other features posteriorly, dorsal aspect, you are able to see four swellings. So that four swellings are actually called as the colliculi. So a pair of superior colliculus and a pair of inferior colliculus, which is called as the corpora quadrigemina. Okay, so the superior colliculus are a visual relay center and the inferior colliculus are auditory relay centers. So each colliculus is connected to the geniculate bodies. Inferior colliculus is connected to the inferior geniculate body by inferior brachium. Superior colliculus is connected to the lateral geniculate body by the superior brachium. And this is your pineal gland, which we have seen the posterior relation. This opening is the third ventricle, which is the cavity of the diencephalon, which is present between the two thalamus. The posterior expanded part of the thalamus, which you are able to see here, is your pulvinar of thalamus. Okay, that is actually called as the pulvinar of thalamus. Okay. Now these four colliculi are separated by cruciform sulcus. So which has got a vertical part and then it has got a transverse part. And below you are able to see that is the superior cerebellar peduncles. Okay. So the diverging superior cerebellar peduncles from the posterior aspect of the midbrain. This is your massive middle cerebellar and that is your inferior cerebellar peduncles which is coming from the medulla. So the gap between the two diverging superior cerebellar peduncle, there is a membrane called as the superior medullary velum, okay, which forms the roof of the fourth ventricle. Okay, so the roof is mainly formed by the, it is tent shaped. So superior medullary velum, and what pierces the superior medullary velum is your fourth cranial nerve or your trochlear nerve. Okay, so the trochlear nerve actually pierces, runs then laterally and anteriorly. So only cranial nerve which is emerging from the midbrain is your superior midbrain is your trochlear nerve. So that is your superior medullary velum stretching between the two superior cerebellar peduncles. So dorsally you see the pair of superior colliculi, inferior colliculi, superior and inferior brachium. Superior and inferior brachium connecting to your medial and lateral geniculate bodies. This is your superior medullary velum. Okay, so that is the dorsal aspect of the midbrain where you can appreciate the external features. Now, coming to the internal features of the midbrain, mainly you come across the ventral part is actually called as the crus cerebri. Now, again, the internal features is actually discussed at two levels, at the level of superior colliculus and at the level of inferior colliculus. So, first we are going to discuss about the level of inferior colliculus. Okay, so before that we are going to see the internal features which are common to both the levels. So the common to both the levels is mainly your the ventral part is actually the common part, and here you are able to see the crus cerebri. Okay, so the crus cerebri forms the ventral part, and then the dorsal part is actually called as the tectum. Okay, so if you draw an imaginary line passing through the cerebral aqueduct, through the center, transverse line passing through the center of cerebral aqueduct, dorsally what you see is the tectum, and ventrally this part is actually called as the tegmentum. Okay, so this is tectum, this is tegmentum, and front what you see is the crus cerebri. So first coming to these cerebral peduncles. So this massive cerebral peduncles from anterior to posterior, it has got three parts: crus cerebri, then you have a band of gray matter which is called as the substantia nigra. Okay, so that is actually called as the substantia nigra. Okay, so crus cerebri, substantia nigra, and more posteriorly what you see is the tegmentum. Okay, so this is your crus cerebri followed by the substantia nigra, and then more posteriorly this area is actually called as the tegmentum. Beyond the cerebral aqueduct it is called as the tectum. So internal aspect can be divided into tectum, tegmentum, and then your the crus cerebri and the substantia nigra. So first let us understand about the crus cerebri. So they are again large bundle of nerve fibers, uh, mainly consisting of corticospinal, corticopontine, and corticonuclear fibers. So mainly the medial part you have the frontopontine fibers. Mainly you have the medial part, you have the frontopontal fibers, medial 1/6. Then middle or intermediate part consists of mainly your corticospinal. So forms the motor tract, pyramidal tract, corticospinal. Then you have the corticonuclear or bulbar fibers to the cranial nerve nuclei at the below level. And then more laterally you have the paritopontine, temporopontine fibers. Okay, so they are all mainly descending fiber. If you trace this above the midbrain, they will form the internal capsule. A very important region which we will be discussing later is the internal capsule. And below what happens, you know, in the pons, The corticospinal fibers are broken into discrete bundles, corticospinal and corticonuclear, whereas all these frontopontine, paretopontine, temporopontine fibers relay in the pontine nuclei. So that is about the crus cerebrae. The whole thing along with the tegmentum and substantia nigra is called as cerebral peduncle or basis pedunculi. Okay, then beyond this crus cerebrae, you see a band of gray matter due to rich neuromelanin pigments. It is called as nigra, so dark in color, substantia nigra. So this substantia nigra, as I told you, is a band, and it has got two parts. The front part is actually called as pars compacta, and the behind part is actually called as the pars reticularis. Pars compacta and pars reticularis. So mainly it secretes dopamine, okay, and then cholinergic fibers, and posterior part mainly secretes GABAergic fibers they contain. So GABA aminobutyric acid. So dopamine, GABA aminobutyric acid are all they are inhibitory neurotransmitters. Okay, so dopamine will be secreted to the corpus striatum. So mainly it will have connections with the corpus striatum. So don't worry about what is corpus striatum. It is a part of the deep nuclei present within the cerebral hemispheres, which is called as the basal nuclei. The older term is actually called as the basal ganglia. Okay, so the corpus striatum, it is connected, mainly it has connections. The substantia nigra has connections with the corpus striatum. Okay, and then coming to the other features, the tegmentum. So we have seen about the crus cerebrae and then the substantia nigra. In the tegmentum, again you are able to see the lemniscal pattern. So mainly you are able to see the medial lemniscus, and then you are able to see the trigeminal and the spinal lemniscus. So I need not discuss about these too much, because we have already been seeing this right from your medulla and pons. Okay, then periaqueductal gray matter. So around the central cavity, the cerebral aqueduct, you see the gray matter surrounding it. The central gray matter is called as the periaqueductal gray matter. You're able to see the trochlear nerve nucleus. So the fibers, they arise, then they decussate, and then they emerge. So the crossing over takes place in the superior medullary velum itself, and then they emerge, the trochlear nerve nucleus. More laterally, you are able to see the mesencephalic nucleus of trigeminal nerve. So this is mainly concerned with your proprioceptive impulses from the muscles of mastication, and also from your extraocular muscles, the mesencephalic nucleus. The other nucleus is the principal nucleus, which we have seen in the pons, and one more nucleus is the spinal nucleus. Okay, so the spinal nucleus of the trigeminal nerve. So in the midbrain, you see the mesencephalic nucleus in the periaqueductal gray matter involved with the proprioception for the muscles of mastication and extraocular muscles. Then behind the substantia nigra, this lemniscal pattern is present, which we have already discussed. Then more laterally, you see the lateral lemniscus. So this lateral lemniscus is the crossed fibers of the trapezoid body, auditory fibers. So which are actually coming from the, this forms the part of auditory pathway. They will go and relay into the inferior colliculus, because inferior colliculus is a auditory relay center. Okay, then so ventral to the cochlear nucleus, you see this the other tracts, the medial longitudinal fasciculus and the tectospinal tract. So medial longitudinal fasciculus and the tectospinal tract, which you are able to see here, and more ventrally you are able to see the crossing of the decussation or crossing of the superior cerebellar peduncles. So crossing of fibers of the superior cerebellar peduncles, and more anteriorly you see the rubrospinal tract. From the red nucleus, it is descending to the spinal cord. I told you it is a part of your extra pyramidal system, rubrospinal tract. So all this you are able to see in front of the central gray matter in the tegmentum, the tectospinal, and then your medial longitudinal fasciculus, decussation of superior cerebellar peduncles, and then your rubrospinal tract. So what is inferior colliculus is actually a relay center, auditory relay center. So receives fibers from your lateral lemniscus and also from your olivary nucleus. So efferents from this will go to the medial geniculate body, which we have seen in the pulvinar of thalamus, and from there it will go to the auditory cortex, okay, acoustic area of the cerebral cortex. So medial geniculate body, how it is connected to the medial geniculate body? Via the inferior brachium. That also we have seen in the external features. Okay, so mainly efferents to the medial geniculate body via the inferior brachium, and also through that it goes to the, I told you, to the auditory cortex, and it also have connections with the inferior colliculus. Okay, now this is mainly concerned with the discrimination of the sound, whether it is from the right ear or left ear, and also with respect to the source of the sound. It also responsible to identify the source of the sound, from where it is actually coming and from how the sound is coming. So that is the main function of this inferior colliculus, which is the auditory relay center. Next, coming to the superior colliculus level. So at the level of superior colliculus, mainly this is your central gray matter, and in that you see the oculomotor nerve nucleus. Okay, so mainly you come across the oculomotor nerve nucleus. It is actually a nuclear complex, because each muscle has again got a subnucleus within the oculomotor nerve nucleus, and in front of it what you see is the Edinger-Westphal nucleus anterior to it, which is the parasympathetic part, which is going to innervate your sphincter pupillae and your ciliaris muscle. Now, the Edinger-Westphal and the nucleus, you are able to see anteriorly they fuse, both nucleus they almost fuse in the midline, and they form your oculomotor nuclear complex. The fibers, they pass through the rubrospinal red nucleus, and then they emerge via the interpeduncular fossa. That is the third nerve, the oculomotor nerve emerging. Then in front of the tectum, so you have the superior colliculus. Now you have one more nucleus which is called as the pretectal nucleus. So the pretectal nucleus is again concerned with your pupillary light reflex. Okay, so mainly it is actually concerned with the pupillary light reflex. So you have direct and consensual light reflex. When you throw a light on the pupil, it contracts, and consensual is even the other eye where the light beam is not focused also contracts. So that is called as pupillary light reflex. So other one is accommodation reflex. When you actually look into a nearby object, then also your pupil contracts. That is because of the constrictor pupillae muscle that is passed through the Edinger-Westphal nucleus. Okay, that is called as the what do you call it, as the accommodation reflex. One is pupillary light reflex, which is direct and consensual, and other one is the accommodation reflex. Okay, so the pretectal nucleus is mainly concerned with the pupillary light reflex. Okay, so and then what happens is you also have the tectospinal tract, which is passing from your superior colliculus and for connecting the fibers to the inferior colliculus and going downwards to the spinal cord. That is mainly responsible for moving your head based on your visual and auditory stimuli. Then of course behind the, in the tegmentum, behind the substantia nigra, you see all these lemniscal pattern, again medial, spinal and trigeminal lemniscus. Lateral lemniscus is not seen here because it has already relayed in the inferior colliculus. Okay. The other features you see a tegmental decussation, dorsal and ventral tegmental decussation. So dorsal tegmental decussation, this is your ventral tegmental decussation which you are able to see here. Dorsal tegmental decussation is mainly for the fibers of the superior colliculus crossing and forming the tectospinal tract, and ventral tegmental decussation is crossing of the red nucleus. So ventral tegmental decussation is crossing of the red nucleus, and dorsal tegmental decussation is the your tectospinal tract. So just now I explained what is the tectospinal tract. And then so you are able to see these large nucleus apart from your Edinger-Westphal oculomotor nucleus, pretectal nucleus. You are able to see this large nucleus, the red nucleus. So it is the nucleus of extrapyramidal system. So it mainly receives afferents from cerebrum, then cerebellum, okay, and then from your basal nuclei, corpus striatum I told you, and subthalamus and hypothalamus. Okay, so then it gives efferents. Again, efferents it gives to third, fourth, sixth, and your seventh nerve. Okay, and then also back to the cerebrum, inferior olivary nucleus and reticular formation. So main function, as I told you, smooth coordination and maintenance of muscle tone. So that is the main function of this extrapyramidal system. And the rubrospinal tract, as I told you, passes via through this third, fourth and sixth nerve. It gives fibers to all these cranial nerve nuclei. Okay, then what about the superior colliculus? Is a visual reflex center. So the retinal fibers, what happens is it passes via the lateral geniculate body, and from there it relays into the superior colliculus, mainly responsible for reflex movement of head in response to visual stimuli, because fibers from the superior colliculus will go as tectospinal tract, which will perform this movement of head in response to visual stimuli. So afferents, as I told, from lateral geniculate body and from visual cortex, occipital cortex area 17, 18. Then spinotectal tract fibers it also receives from spinal cord and also from the inferior colliculus. So efferents mainly to the spinal cord via the tectospinal and also to the cranial nerve nuclei of third, fourth and sixth. So concerned with the extraocular muscles of the eyeball, that is the tectobulbar, okay, and also lower nuclei which is responsible for moving the head, okay, in the medulla and the spinal cord. So efferents mainly to the spinal cord via the tectospinal tract, corticobulbar to these extraocular muscles of the eyeball, nuclei supplying the extraocular muscles of eyeball and also moving your head muscles. Okay, so this is mainly the connections of the superior colliculus, which is a visual reflex center. So blood supply of the midbrain is mainly by posterior cerebral artery. You are able to see that is the posterior cerebral artery. So the vertebral artery divides into two terminal posterior cerebral arteries, then superior cerebellar arteries, and also branches from posterior communicating and anterior choroidal arteries, superior cerebellar arteries, and also from will give posterior communicating artery. This is all part of the circle of Willis, which we will be discussing in the blood supply of the brain. So coming to the clinical aspects, main thing what you are able to see here is the Weber's syndrome. So mainly when the posterior cerebral artery is affected, so your basilar part, your crus cerebri is affected, and symptoms include mainly ipsilateral squint, lateral squint. Third nerve is affected, sixth nerve is not affected, so the eyeball is pulled laterally, lateral squint. Drooping of upper eyelid, again because levator palpebrae superior is supplied by your oculomotor nerve. So oculomotor nerve fibers are affected. Contralateral hemiplegia because of corticospinal tract. Okay, so opposite half of the body paralysis, motor paralysis. Then contralateral paralysis of face and tongue, again because of the hypoglossal nerve, facial nerve nucleus. Lower corticonuclear fibers are affected because they are all passing in this intermediate area. Okay, and then you also have loss of accommodation reflex because Edinger-Westphal nucleus is affected. So pupils are dilated and fixed. So it cannot accommodate. Pupillary constriction or dilatation does not take place. Next, coming to the Benedict's syndrome. So contralateral loss of pain and temperature because lemniscus, your mainly your spinal lemniscus is actually affected, and then proprioception because of medial lemniscus, and then ipsilateral squint because again oculomotor nerve is involved, oculomotor nerve is involved, and then tremors, red nucleus. So muscle tone is lost, you have tremors in the muscles. Okay, so contralateral tremors because of the involvement of the red nucleus. And what is perinoid syndrome? So when you the both the superior colliculus, if there is a lesion mainly again to the blood supply, there is loss of upward gaze. Okay, because this is mainly thought to the control of the upward gaze is within the superior colliculus. When there is only unilateral lesion, you have conjugate gaze is lost. So unable to track the moving objects. So your conjugate tracking, as you based on the object is moving, your both eyeballs should track the movement. That conjugate gaze is lost because of the unilateral lesion, and especially in only one eye, that is the opposite eye. Because and then Argyll Robertson pupil is a lesion to the pretectal nucleus. So you have accommodation reflex, but you don't have the reaction of the pupil. Light reflex, pupillary light reflex is lost. So it accommodates but does not reacts. Okay, Argyll Robertson pupil is A for accommodation, or for reaction, pupil present. It is called as accommodation reaction present. Okay, so that is about the Pons and the midbrain, and thank you very much for your patient listening.